What's up, guys? Hey, Jared Beckstrand here, doctor of physical therapy and owner-founder of ToneandTitan.com, coming at you today from the Consumer Health Digest channel. They invited me on to come and talk to you guys about 3 of the best ab-strengthening exercises that every mom should do after giving birth. And so I'm excited to be here. I'm excited to share a little bit of what I know about this topic with you. Quick plug for their channel, you guys. If you haven't done so already, go ahead and hit that subscribe button down below. Consumer Health Digest shares a lot of really great information about health and wellness. It's really going to help you guys out. I hope you take the chance to subscribe to this channel. All right, so as a doctor of physical therapy, one of the patient populations that I enjoy working with the most is postpartum women. Whether they're referred to me for low back pain, SI joint pain, diastasis recti, there's a lot of conditions that can happen with pregnancy that physical therapy can really help with, that the right strengthening exercises can really help with. And so again, I'm excited to share with you today 3 of the best ab exercises that every woman should be doing after giving birth. Now, these are actually some of the kind of core foundational moves for a progression that I would take you through if you were one of my patients. In fact, I've written out that entire progression and grouped it into a program that's called the Mommy Tummy Fix. You can learn more about this program and about this progression to these exercises in the link down below. That will take you to the Mommy Tummy Fix, where you can learn more about it, also see some of my wife's progress, some progress that I've taken other people through. I hope you take the chance to click on that link down below. Okay, so let's talk a little bit about what I know. So as a physical therapist, I get referrals for basically postpartum women all the time. Most of these are having some sort of ab issue, some sort of abdominal strength issue, even kind of lower back pain, and a lot of them kind of have the same problem. A lot of them will say, I'm working out, I'm doing, what I think I should be doing. How come I'm not seeing any progress with my core? How come my abs aren't getting stronger? How come my core strength isn't improving? Now, here's the thing that I tell all of them, and here's the point that I want to make with you guys. Ab training and ab strengthening after pregnancy looks a lot different than it did before pregnancy. Before pregnancy, you were probably doing a lot of sit-ups and crunches and planks and things of that nature. After pregnancy, we actually want to avoid those exercises and swap those out for a different one. Let me tell you why real quick. You need the anatomy lesson to understand why you need to be doing these and maybe what exercises you should avoid instead. Now, when we talk about our abs, it's made up of 4 layers. The most superficial of which, and the one that we kind of spend the most time on, is called your rectus abdominis muscle. It goes from your lower ribs to the top of your pelvis. It's that 6-pack muscle that comes right down the front, and basically it's 2 halves that are connected down the middle by some connective tissue. It's called your linea alba. With pregnancy especially, that muscle actually gets stretched and distended. That connective tissue gets stressed out, can even tear in some cases in a condition which we would call diastasis recti. Now, after pregnancy, what we want to do is rehab, especially that muscle. A lot of times it's that diastasis recti, even that kind of stretched out rectus abdominis muscle that's going to cause that mommy pooch or that mommy tummy that a lot of women experience. In fact, that diastasis recti condition occurs in about 60% of pregnancies, and even 1 year later, about 30% of those still present with it. So it's kind of a big deal. Okay, so what should we do instead? Now, it's those sit-ups, those crunches, and those planks that are all stressing out that muscle. What we want to do is lay off of those and actually think a little deeper. Now, when I say a little deeper, your innermost core layer or your innermost core muscle is called your transverse abdominis muscle. It actually originates right on your lower back and then wraps around your sides and connects right underneath that rectus abdominis muscle. It actually kind of forms or connects into that same connective tissue underneath it. What it does, that's the muscle that's actually going to suck in your stomach and kind of bring everything in tighter. Like if you were to suck your belly button in towards your tummy, it's that transverse abdominis muscle that you're activating. Now that is the key to all of this. That's the muscle that we want to activate. That's the one that we're focusing on in our postpartum ab strengthening exercises. That's where our focus needs to be. So again, we want to lay off the sit-ups, the crunches, and the planks. Those things are going to stress out this muscle. We want to do different exercises. We want to activate that transverse abdominis muscles. I'm going to go get my professional and we'll show you guys how that's to be done. All right, you guys, so let me introduce you to my wife / professional core rehab post-pregnancy exercise demonstrator. We've actually had 4 kids. And Camille, we've rehabbed a diastasis recti with 3 of those. So she's kind of my professional at these exercises. I brought her in to give you guys some better demonstration of what these exercises are going to look like. So let's get into it. Okay, so the first thing that Camille's going to do is lay down on her back, and the most important thing that I can show you guys is just how to activate that transverse abdominis muscle, and that's the first step to a lot of the progression that I run patients through. And so in order to do that, what we need to do is first get her spine in a neutral position. And so to do that, you'll see that her back is really arched up off of the table right now. I can slide my hands underneath it pretty easily. The first thing I want you to do is kind of rock your hips backwards, push your back down into the table. That's step number one, is to introduce that posterior pelvic tilt, flatten your back. And then the next step is to tighten your tummy up. So what I want her to do now is use her muscles to suck her belly button in towards her spine and hold it for about a 3 count and then relax. And that's it. It's a really small movement, but again, we're just activating that muscle. We're getting it used to fire. And so again, flatten her back and then tighten her tummy up. Squeeze her belly button into her spine, hold 3 seconds, and then relax. Now, the thing that I see the most often with this, and she'll do it wrong now, is a lot of times when I tell people, okay, suck in your stomach, they take a deep breath in. And so by her taking a breath in, yeah, that's going to suck your stomach in towards your spine, but all it's doing is creating a negative pressure in your abdominal cavity, so I don't want that. Sometimes what I'll tell people in order to get the right contraction is I want her to breathe out all of her air first, so she's going to breathe out all of her air, now suck in your stomach. And you'll see that she's able to do that. Even with no air in her lungs, she's still able to activate those muscles to fire that transverse abdominis muscle. Again, that's that corset muscle. That's the one that's going to suck everything in nice and tight. That's the one that's even going to bring that separation closer together. So that's exercise number 1. To take this to the next level, exercise number 2 that every postpartum mom should be doing to strengthen her abs, we're going to show you some dying bugs. So we're going to start on that same foundation. Now we're just going to add to it. And so Camille's going to bring both of her knees up towards the ceiling in this 90-90 position. So 90 at the hips, 90 at the knees. We call that a tabletop position. She's also going to bring both of her arms straight up towards the ceiling. And so now we've eliminated this base of support down here, causes the abs to work a little bit harder, but then we're also going to add some reciprocal limb motion. To explain what that means, what she's going to do is flatten her back, tighten her tummy, so suck that belly button in towards her spine. Now she's going to slowly lower this left leg towards the ground while her right arm goes up and over her head, and then back to that same starting position. Now we're going to do left arm, right leg, and then back to that same starting position. Again, the most important part here is that I want your back flat and I want that stomach sucked in. Again, that belly button drawn in nice and tight, activating that transverse abdominis muscle while we're going through some of these limb motions. And so as her arm and leg move out, it makes it harder to hold that contraction, makes that contraction a little bit more effective. And so that's exercise number 2. Exercise number 3 is going to be a side plank. So Camille's going to roll over onto her left side. And what I tell people is, if you're recently postpartum, well, let me mention first, you need to wait for, go ahead and come down, you're going to be there for a while. If you're recently postpartum, make sure you wait for 6 weeks if it's been a normal vaginal delivery, 8 weeks if there were any complications or a C-section before starting any exercise program, especially core rehab like this. And so if you're recently postpartum, kind of that 6-week mark, just getting back into this, or maybe your core is not as strong as you would like it to be, I like to start with what we'd call a modified side plank. And so she's on her left elbow. So you see that she bent her left leg and her right leg's still out straight. Now what she's going to do is use the muscles on her side, on her left side, to raise her left hips up off of the table. Now, a lot of you will be able to do that, but the key is, again, now we're going to add that transverse abdominis contraction. And so up in this position, now she's going to suck that belly button in and hold that for the duration of this exercise. I tell people shoot for 20 to 30 seconds. Go ahead and come down. And if that gets easy, what you're going to do is get into a full side plank. So we're taking it from the modified side plank to the full side plank. And so now her left leg's out straight. She's on her left elbow. And so we're up in this full, side plank, up in suspended position. But then again, she's going to hit that TA contraction. She's going to suck that belly button in towards her spine while she's up in this position. I tell people, again, about a 20 to 30 second hold. You're going to repeat that 3 times on the left and then 3 times on the right. I'm just now realizing I didn't give you numbers for any of the other ones. The first one, the stomach vacuum, the TA contraction, you're going to hold for about a 3 to 5 second count and repeat that 30 times. And then with the dying bug, I tell people 3 sets of 10. So do 10 of the alternating arm and leg, take a break, and then repeat that 2 more times, 3 times total. And so there they are, you guys. So those are, again, 3 of my favorite exercises that are going to strengthen your abs after pregnancy or after giving birth. I hope you guys found these beneficial. If you did, do me a favor and hit that thumbs up button down below, and thank you so much for those likes in advance. Also, one more plug, if you guys haven't subscribed to this Consumer Health Digest channel, I hope you take the chance to do so. They share a lot of really great information. They bring in a lot of professionals to share this type of information, their areas of expertise with you. So it's a great way that you can get a lot of really good information in one place. So again, if you haven't done so, please subscribe to this channel. Also, if you have any questions or comments, leave that in a comment down below. We'll be sure to answer that as soon as we can. And then one more thing, there's going to be a couple videos or a couple of pop-ups after I'm done talking here that are going to pop up. Some more great exercises, some more great videos having to do with your postpartum health. I hope you take the chance to check those out. Again, my name is Jared Beckstrand. I'm a physical therapist over at toneandtighten.com. And thanks for joining me today. I hope to see you again soon.